Hello and welcome to week 3 of summer pharmacology. The first thing I'm going to do is go over some of the questions from the Kahoot quizzes that were more frequently missed, just to review that information and make sure that we all understand it well. So the first one we're going to talk about is epinephrine. Is it selective or non-selective? And the correct answer is non-selective. Epinephrine affects different receptors, so it's not selective affecting one receptor. It's actually affecting the alpha-1 receptors, the beta-1 receptors, the beta-2 receptors. Remember, this is an emergency medication. We need it to get in the body and do anything it can to try and keep our patient alive. So it's going to work to increase blood pressure, increase heart rate, open up the airways, bronchodilation, and that's done by affecting multiple receptors. And again, that is why epinephrine is non-selective, because it affects multiple receptors. Albuterol, on the other hand, is a selective medication. It's selective for one receptor. And is it beta-1 or beta-2? The correct answer is beta-2. And if you have problems remembering that, remember that I have 2 lungs, 1 heart. Albuterol, I know it's inhaler. I take it for my asthma. It's for respiratory disorders. I know it's affecting my 2 lungs. It's affecting the beta-2 receptor. Norepinephrine, is it an adrenergic agonist or an adrenergic antagonist? If you look, it has the name epinephrine within it, right? So this is one of those medications that you need to recognize which class it's in. Just like epinephrine, norepinephrine is an adrenergic agonist. Atenolol, we know because of the LOL that we're looking at a beta blocker. Beta blockers, most people can remember pretty easily that that's going to cause blood pressure to decrease. It's important for us to remember that it's also going to cause pulse to decrease also, because we want to be assessing our patient's pulse and blood pressure prior to administering a beta blocker, such as atenolol, because it's going to cause both heart rate and blood pressure to decrease. Are non-selective beta blockers used with extreme caution in patients with asthma or glaucoma? We're worried about patients with asthma who are taking non-selective beta blockers, because again, it's affecting that beta-2 receptor, right? And so if that's blocked, it's going to lead to bronchoconstriction, which can be problematic for the patient. The cholinergic agonist is contraindicated in the patient with, correct answer is asthma. So the 2 big contraindications with this adrenergics and cholinergics you need to know is glaucoma and asthma. So a cholinergic agonist is going to allow the parasympathetic system to show its signs and symptoms in the body, right? And so with the parasympathetic system being full force and exhibiting its results in the body, if you will, I'm worried about bronchoconstriction, right? Because my sympathetic opens up airways. My parasympathetic causes bronchoconstriction and increased secretions. This is why cholinergic agonists would be contraindicated in the patient with asthma. Now, this medication in and of itself, pilocarpine, is actually used to treat glaucoma. And so how does it affect the pupils if it's being used to treat glaucoma? If it's being used to treat glaucoma, one way it may affect pupils is miosis. So constriction of the pupils is good for glaucoma. Mydriasis or dilation of the pupils is bad for glaucoma. Cholinergic agonists are contraindications for patients with severe tachycardia or intestinal obstruction. So cholinergic agonists, I go back, cholinergic, I know I'm talking about my parasympathetic, and it's encouraging it or engaging those receptors. So I'm going to see the rest and digest process in the body. So knowing that rest and digest is what's going to be demonstrated by my body, is severe tachycardia or intestinal obstruction an issue? And the correct answer is intestinal obstruction, because if I'm in rest and digest and my body's trying to move through the contents of my GI tract, but I have a blockage, that's going to be problematic. It could actually lead to a rupture. Cholinergic agonists would be contraindicated for patients with severe bradycardia, right? Because their pulse rate would actually go down, heart rate would go down with a cholinergic agonist. The antidote for cholinergic agonist overdose is, so looking at this, one of these medications is an anticholinergic. Atropine is an anticholinergic. It is used as an antidote for cholinergic agonists, right? It's the opposite medication. Now we're going to move on to the homework assignment of the sympathetic versus parasympathetic nervous system and what you will see. So go ahead and pause the video and check your homework to the correct answers as I go through. And you can review the answers to the Chapter 15 and 16 homework assignment. It's listed under the Week 2 module, Chapter 15 and 16 homework answers. So we've talked about the Kahoots, the SNS versus PNS, you know how to access the answers to the Chapters 15 and 16 homework. Lastly, you were assigned the Swift River assignments, and everybody seemed to get through those without any issue. Just a reminder, those Kahoots, you can access them again while studying for the exam. So if you didn't do well the first time or you just want to go over it as a practice, you are able to access those Kahoots again prior to the exam 1. Alright, so now let's look at our assignment for this week, week 3. So your assigned readings, you got chapters 17, 18, and 19. And then we're going to talk about, or on your own rather, you're going to review vitamin B12 and aloe vera. So after your assigned reading, you have the recorded lectures that you're able to access and listen to as many times as you need to. And then let's look at homework here. So we'll start homework. The first thing, prepare for exam 1. Exam will be on campus on Monday, June 8th at 8 a.m. So it starts at 8 a.m. when that door's shut. If you're not in there, unfortunately, you won't be able to join us. And you'd have to make arrangements with me to test within 24 hours. So let's see your room assignment. I'll show you that in a minute, and I'll also have room assignments posted at both classrooms because we're going to have to be split up for social distancing. In terms of testing also, all assignments have to be done. So if you notice for this homework it says note due dates because it's a little different than they normally are. They're all due by Friday at midnight. And again, that's to make sure that all homework assignments are turned in and there aren't any problems, because if I don't have someone's homework, I need time to realize they haven't submitted it prior to Monday at 8, which is when the exam begins, right? So all homework for this week is going to be due by Friday at midnight, and that'll give me time to reach out to anyone who may have missing assignments prior to the exam. So homework, besides preparing for exam 1, your Kahoot, you have a Kahoot of stimulants, depressants. Kahoot, you got your PIN number right there. That's a complete or incomplete, due Friday by midnight. Chapter 19 homework can be found under week 3 module. It's actually, when I uploaded and scanned it, it has chapter 19 and 21 together. You are only responsible for doing chapter 19. We'll get to chapter 21 when we cover it, but only chapter 19 is due at this time, which would be due by Friday at midnight, and it needs to be submitted by the Dropbox. And if you prefer to type out the answers, 1C, 3B, and send it that way, if you scan it, if you take a picture, whatever it is, just needs to be submitted by the Dropbox by Friday at 11:59. And then finally, I uploaded a practice quiz, which can be found under the quizzes tabs in Canvas. The quiz is for practice only. It has no point value. And what I advise is that you do not use your book while you're taking the quiz. Use it as a practice quiz to assess what your weak areas are. So do some studying, go through week 3's homework assignments and everything, and then the practice quiz isn't just on week 3 information, it's mostly previous information that we've covered. But take it and without having your book open, as if you were taking an exam, to see where your weak areas are. This has no point value. It's not going to matter if you get a 50% on it. For me, it's a complete or incomplete as long as you've taken it by Friday at 11:59 is all that matters to me. So room assignments, we're going to be having our exams in D102 and D104. So you can see with the week 3 plan which room you've been assigned to. And so I'm just going to wrap up by encouraging you to put everything you can into this first exam, because how you perform on the first exam really sets the tone for the rest of the semester for you. If you perform well, you sort of have a little padding, you get some confidence. If you don't do well, if you come in not unprepared, unfortunately you end up in the hole that you spend all semester trying to dig yourself out of. It becomes a stressful semester and overwhelming and just a negative experience. So if you can put everything you can into being successful on this first exam, your whole semester will be a little less stressful